practiced this last night. I did really good, but you know how it goes. I've heard y'all say that before. Okay, bam, bam, bam. Thank you. Hello. My name is Brenda Woodman C., and I'm a student nurse at the University of South Alabama, and I'd like to do your cardiovascular assessment today. Okay. And I'm going to ask you to please take off your shirt and your shoes, and we're going to have you lie down on this exam table. Okay. And I'm going to pull out the bottom here for your leg. There we go. And I'm going to stand on the right side and move this chair over a little bit. Okay. So now first I'm going to inspect. So I'm going to look across the precordium to see if I can visualize the apical impulse, and I can't, but it would be seen at the 4th or 5th intercostal space at the midclavicular line, the left side of the sternum. And while I'm looking, I'm also going to look for lifts and heaves, and I don't see any lifts and heaves either. And while I'm standing here, I'm going to go ahead and state that the normal heart rate is 60 to 100 beats a minute, and that it's regular rather than irregular. And I'm also going to state that the base of the heart is found at the 2nd intercostal space on the right and left of the sternum, and the apex of the heart is at the 4th or 5th intercostal space, midclavicular line, on the left side of the heart. So now I'm going to move to palpation. So I'm going to palpate with one finger at the apical impulse, the 4th or 5th intercostal space, midclavicular line on the left side, and I'm going to have you take a breath and exhale and hold it. I actually feel the apical impulse. Okay, then I'm going to move on to auscultation. So I'm going to be auscultating the heart, the valve sounds, and my locations are the aortic valve, which is heard at the 2nd intercostal space to the right of the sternal border, and the pulmonic valve is the 2nd intercostal space to the left of the sternal border. The tricuspid valve is the 4th or 5th intercostal space to the left of the sternal border, and the mitral valve is the 4th or 5th intercostal space, midclavicular line, left side of the heart. So now, I'm going to listen. With my diaphragm and my bell. So S1 and S2 were clear. I heard no extra heart sounds or murmurs. I'm going to talk about the auscultatory relationship. S1 is the lub and S2 is the dub. S1 is the beginning of systole, S2 is the beginning of diastole. S1 is heard best at the apex, and S2 is heard best at the base. And S1 is the closure of the AV valves, which are the mitral and tricuspid valves, and S2 is the closure of the simulinar valves, which are the pulmonic and aortic valves. So now we're going to check your pulse deficit. So I'm going to auscultate at the apical impulse. And if you turn your head just a little bit that way, I'm also going to palpate the carotid artery. They're exactly equal, so no pulse deficit. So now I'm going to listen for carotid bruits. I'm going to have you look at them again. I'm going to listen with my bell. I don't know if I mentioned that earlier, and I'm going to have you take a breath and exhale and hold it. You can breathe. And I'm going to have you turn towards me and take a breath and exhale and hold it again. You can breathe. And no bruits were noted. Now I'm going to palpate the pulses. And I'm going to do the carotid first. And then I'm going to do the brachial. Sorry, I got to do this right. Taking this off. Okay, you can put your arm get them, take their watch off. That was the radial. And I'm going to verbalize the femoral artery, which is found in the groin area below the inguinal ligament, and it's between the pubis and the anterior superior iliac crest. And then I'm going to go down here and feel the dorsalis pedis pulse. This. Okay. So all of her pulses were 2+ and equal bilaterally. So I left here too soon. Now I'm going to check for edema. And I don't notice any edema. And now I'm going to check for perfusion in her hands and fingers. I'm looking, actually they're a little bit chilly, but she's convex and pink, pale pink, but she does have good capillary refill, less than 3 seconds. Now can I get you to do this? Okay, and I see a diamond, so that means no clubbing, that's normal. Means less than 160 degrees. Now I'm gonna stand back for a second and make sure I did everything. I inspected and I did the normal heart rate and rhythm, and I did lifts and heaves, and I did the apical impulse, and I talked about the base and the apex. Then I palpated for the apical impulse, then I auscultated the 4 valve sounds, and I talked about the auscultatory relationship, and I listened with the bell and the diaphragm, and then I did a pulse deficit, and then I did carotid bruise, and then I checked all the pulses, and then I did edema, and then I did the hand. I think that's it. Completes my cardiovascular assessment. Let me make sure I didn't forget. We'll see what kind of grade I made.